Hello everybody, I'm Laura Cruz and presenting the start of my presentation on generalization between verbal operants within discrete trial training implemented by parents. This is the beginning of my thesis proposal and want to just send a quick thanks to Dr. Griffith for all her help with the introduction thus far. First, I really looked at what the rise of autism and what that need for intervention was. So, autism spectrum disorders are a neurological disorder that affects social communication and social interaction. The current statistics put it at 1 in 68 children, which is up over the last 10 years or so from about 1 in 110. So, as we're seeing this rates on the rise, that need for effective intervention becomes more and more important. One of the more common and most effective interventions, most highly researched, is applied behavior analysis. Since kind of the original landmark Lovaas study in 1987, we've seen an evolution of it, but still those ABA components have held strong within the research. In particular, not just ABA in general, but using those ABA methodologies within an intensive early intervention program is very strongly recommended and shows strong outcomes for children when you get them in that 2 to 6 year old kind of age range and really get them started early. Another key component in early intervention is that parent involvement. So Ozanoff and Cathcart in 1998 took 2 groups of children who were in a special education preschool, and for one of the groups they added a parent training component that was based on the TEACH program. When they looked at child outcomes, that group which had the parent training component added showed 3 to 4 times the improvement compared to the control group that was just receiving the special education classroom services. Furthermore, when resources are limited, whether it's financially due to lack of insurance coverage or geographically of just access to quality services, parents may need to act as therapists part of the time as well. And so therefore, we do need to look at what kind of training methods are most effective for them. There are many different types of training methods out there. Some are entirely group-based, some are a combination of group and one-on-one, some are much more just instruction and lecture, others are much more hands-on. So when looking at ways to develop effective parent training, a couple of research studies that I looked at, Miller and Sloan, looked at training parents to modify the antecedents and consequences contingent upon speech sounds from their child. So they did it during a snack time and kind of had a structured training that used instruction and feedback for them on responding to when their child made speech sounds. So the parents were able to implement the protocol, as well as the children did show increased use of speech sounds. However, when they went to check for generalization during outside of that snack time, during a pre-snack time period when parents were getting ready for snack, they did not see generalization in the parents responding to their children's speech sounds then. They did note that it may be due to the parents were involved in the other activity of preparing the snack, and so looking at what components kind of help develop that effective parent training that can be then generalized across settings. Tarbox, Wallace, Penrod, and Tarbox in 2007 looked at training parents to implement. It was a 3-step compliance protocol. And so they used both instruction, modeling, and feedback as well. So kind of a multi-component package, and did show generalization was able to occur across different compliant behaviors. So the parents were able to train on a specific demand that they wanted the child to comply with, and they were able to use that protocol across against other aspects. So this really speaks to that need for a multi-component training package. Other studies look, if they were missing one of those components, so if they only did instruction and modeling but not feedback, we didn't see the effectiveness of those programs definitely decreased, as well as the generalization decreased. Behavioral skills training is a kind of training format that has some strong research behind it now, been used a lot with staff training, and now is kind of moving into the parent training world. Includes instruction, modeling, rehearsal, and feedback. So it's the 4 components. Number of studies that have looked at the effectiveness of that method. Couple interesting studies. There was one on gun safety where they looked at training kids, what do you do if you see a gun? And so making sure that they don't touch it, they go tell a parent, kind of those different steps. And so they were able to show that in, I believe, 3 out of the 4 kids, that they were able to follow that protocol while using the behavioral skills training method. Another study also looked at fire prevention. So if they see a lighter, what do they do, and how do they, can we use behavioral skills training to train them to respond correctly? Hamalitas, Rosales, and Candle also looked at decreasing food selectivity. So they trained parents in this case on how to increase the child's behaviors when it came to accepting new foods. And so using that, where they would first go through, here's how we do it, here's kind of written out protocol, here now is, let me model it for you, okay, now you try it, and then here's feedback on, okay, well, in this case, remember, we're supposed to present it for at least 5 seconds, and you only present it for 2. So giving that feedback. They were able to increase how many foods the child was willing to try. So looking at these different studies, a lot of these behavioral skills training studies looked very specifically at a very discrete skill. So what do you do if you see a gun? What do you do in this specific situation? Specifically compliance protocols. There's that generalization need, and there's definitely a lot of mixed research on that. So kind of, we all probably have read about it, the big Stokes and Bear paper where they recommended generalization be specifically trained, and looking at what are those specific training methods. So multiple exemplars, training common stimuli, not just doing the kind of most common method of train and hope. So kind of looking at 2 different components of generalization. So one is just the generalization of the treatment fidelity. So can you train programs, can you train parents to implement, here's kind of a regular compliance protocol, can they generalize that to other behaviors? Can they generalize, I'm going to be looking at DTT, so if you train them on one DTT program, can they use that across different operants? Or do they need to be retrained for each one? And then looking at generalization of the child responses. So does the child as well generalize? So there's been some of this looking in man training for generalization of both, can the parents keep implementing it then across different mans, and then does the child generalize? And a lot of what they have found is, while the parents can implement the, say, manned protocol across different items, the child does not automatically start doing that response generalization. And so how can we kind of increase both aspects of that? Specifically then, looking at discrete trial training and parent training, it's limited. That discrete trial training seems to be something that parents often think of as that needs to be implemented by the professional, that's something that is not within their scope. And so there are some studies, more and more studies now, on looking at teaching parents to implement discrete trial. But generalization within that is limited. So some of the older studies did not use the full behavioral skills model training method, and they just did kind of the instruction and brief modeling. And so then there was very, very limited generalization in that. There has been some research showing that there is positive child outcomes. The children do respond to the parents implementing discrete trial, as well as some basic generalization. So a lot of the generalization pieces that have been tested, like in the Levascus and Sturmy paper that I'm kind of basing this study off of, they show generalization between a gross motor imitation to a verbal imitation skill. other discrete trial studies. There's one referenced, Shea Wilder and Abelon looked at the generalization between targets in a program. So if you taught, motor imitation of clapping, the parents could then do motor imitation of arms up. So the generalization that has been looked at has been very limited as well. So the purpose of this current study is to look at the effects of training parents to implement the discrete trial training program, both on the parent's ability to implement it, and then the child's skill acquisition, and then generalization of those procedures to other operants. So we're looking at going between tacting and interverbals, and can both the parents implement the other program without getting the specific training, just getting kind of a paper with here's what the program is, and then will the child's responses also improve? So will they learn the skills? The methodology, I'm looking to have 4 parent-child dyads, and the children are going to be 2 to 6 years old, have a diagnosis of autism spectrum disorder, be verbal, and have low levels of severe behavior, and not currently in an ABA program. So recruitment, I'm making flyers, post some local nonprofits on the message boards, doctor's offices, things like that. There'll be a brief initial just questionnaire of, does your child have verbal skills? Are they able to echo? Things like that, just to make sure, since we are doing verbal skills of tacting and intervals, they do need to have some basic verbal skills. There'll be a brief screening once they've kind of been accepted. That'll involve doing the echoic portion in the VB map, just to ensure that their verbal skills are in the right area. And then during that screening too, we'll observe to see if there's any severe behaviors when reinforcers and things are removed. The setting is going to be in a pediatric therapy center. The experimental design is going to be a non-concurrent multiple baseline. So there'll be varying baselines. My goal is to have them be 4 trials or 4 sessions, 8, 12, 16. It will a little bit based on will adjust slightly based on when the data stabilizes as well. It'll all occur over kind of 4 days. So the first day is just going to be reviewing the purpose, the initial study, what are the benefits, what are the risks, getting consent, go over the procedures. Once they sign consent, then doing the screening. The screening will also then determine what the specific targets are for that child, making sure that it's tacts and intervals that they do not already know. The next day will be about a week after that, and that's when the baseline sessions will occur, as well as the training. The third day will be about within 48 hours of day 2, so either the next 1 or 2 days after. That will be the post-training sessions. And then approximately a week after that, I'm going to do a home observation and have them run the discrete trial again to see, one, is the skill maintained, and did they generalize being able to do the skill in the home setting as well. The baseline sessions will involve the parent participants being given a written list of the 10 steps of discrete trial training and the program sheets for the tacting and interverbal targets. The documents will be read to the parents before the beginning of the sessions. And then each program sheet will have that target that we determined in the screening. So the sessions will be 10 trials of each operant, so 20 total trials per session. Between the sessions, the child will be given access to preferred items that the parents have picked for about 3 to 5 minutes. Experimental will kind of prompt them through the timing of all of that. And then they'll be asked to follow each of the programs in collecting the 10 data points per target. After they finish the baseline, we'll go into the training, where the experimental will review the data they collected, describing their overall performance, and then go through kind of the 10 steps and go through which ones they did correctly and which ones that were not done correctly. After that, the experimental will then model with the child how to run a tacting program. Novel tacts will be used on this, so that way they're not potentially learning the skill that is the actual tact that's being tested in the study. And then after it's been modeled, the parent will then practice with their child as well. That's one of a component that some research has shown is kind of crucial for parent training, is really them implementing with their child. So during the practice time, experimenter will provide specific feedback on which components of the checklist were completed correctly. Portions that were completed incorrectly will then explain, model again, and have them go through, do the rehearsal again. This will continue until the parent's able to achieve an accuracy level of 90% or higher for 3 consecutive trials. After that, after they finish all of that, because it could be up to 16, the baseline could be 16 plus the training. The post-training will occur then within 48 hours. And so that way the child is not tired, does not station reinforcement, especially if these are children who are not used to being in that ABA format. This way, so the plan is for them to come on a Saturday and then to come back on Sunday. So the post-training will just be 10 trials of each operant with 5-minute breaks in between. It will stop post-training after 10 sessions or when the child reaches 90% for 3 consecutive sessions for a target. General feedback afterwards will be completed, but not going through every specific line. To check for the operant generalization, so all of the actual behavioral skills training will focus just on the tacting program, but they will be running the interverbal program as well. So then we'll be looking to see if with the training, are they able to improve their implementation, and is the child able to have a higher percentage correct of the interverbals as well. And then that that 4th meeting will be in the home setting where the parents are given make sure they have the checklist and the program sheets again, asked to run 10 trials of each program, and then general feedback will be provided again, and they'll be given opportunity to ask any questions at that time. For social validity, they'll be sent a questionnaire afterwards via online that will ask them basically, was the training valuable for them? Was it valuable for their child? Do they plan to continue to implement discrete trial with their child? Are they going to train anyone else to implement it as well? And any additional comments. So really looking at, from a social validity standpoint, is this something that they're going to continue doing, and are they going to try to disseminate it? That was something when I was looking into some of the social validity research, it really focused on kind of those components. So Schwartz and Baird looked at the purpose of social validity and quoting them to evaluate the acceptability and viability of a programmed intervention. So if they're not going to be implementing it or not train other people to implement it, then really that's very low on kind of that viability measure. IOA, of course, will be collected both on treatment integrity from the experimenter in the training. So there'll be some mock videos of both the training and the sessions to use to kind of train the IOA collectors. They'll have to reach 90% on the mock videos, about 33% of training sessions, and the actual study sessions will be, IOA data will be collected on, and then if it ever drops below, then we'll go back and redo the training. The treatment integrity one will also allow kind of the experimenter to make sure that their operant definitions of everything on the checklist are sufficient. And then that's, as of now, that would be some beautiful mock data results if they were to occur. And then here are some selected references from the introduction and methods thus far. So I appreciate any feedback. Thank you all very much.